The day has finally come. You received the COVID-19 vaccine. But now what? Does this mean you're free to go about your life just like before the pandemic? We checked in with Topline MD affiliated specialists to find out. First of all, do you still need to wear a mask?
Okay, so vaccination is one of the tools that we have to fight this pandemic. So the other tools that we have are the mask, social distancing. So if we're trying to fight this pandemic, we have to use all the tools available to us.
Can you still catch COVID-19? And if you do, can you spread it?
You can get COVID-19 disease. In the study populations of the trials for the vaccine, there was a very small chance of patients developing severe COVID-19, and there were no deaths with COVID-19 illness, which is excellent.
The CDC recently changed its guidelines for those who have been vaccinated. What does this mean for them now?
Right now that you've been fully vaccinated, there are some things that you can do that you weren't able to before. So for example, you can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people without a mask, unless any of those people or anyone they live with has an increased chance of a severe illness from COVID-19, because again, you don't want to expose that person that has an increased risk. If you've been around someone who has COVID-19, you don't need to stay away from others or get tested unless you have symptoms.
So Dr. Nella, I'm sure a lot of your patients are asking the same question. Once they get vaccinated, can they visit with their family and friends or go out in public? And what about for travel? Is that advised right now?
Once your family or your friends are fully vaccinated, and let's just clarify what fully vaccinated means. The Pfizer vaccine is 2 doses that are 3 weeks apart. The Moderna vaccine is 2 doses that are 4 weeks apart. And the Johnson & Johnson is a single-dose vaccine. It is recommended that you stay socially distanced and wear a mask for 2 weeks after your last dose. The vaccines that are currently available, and again, we did mention the 3 vaccines, they are very effective. There are different degrees, percentages of effectiveness, but the protection, again, is not perfect. So it's still advisable to not travel unless it is really necessary to travel. And if you are going to travel, even if you are vaccinated, you should still wear your mask, especially on an airplane, and maintain your social distancing.
So for the high-risk population, being able to get the COVID-19 vaccine was already a huge relief for them. But now that they've had it, are they allowed to go out into the public without any worry, or should they still take some precautions?
I definitely think that the high-risk group definitely needs to take precautions. You need to think of the vaccine as just another layer of protection. It is still very advisable for the high-risk and the senior group to wear their masks when they're out in public and to maintain some degree of social distancing. Yes, their worry can be a little reduced because they are fully vaccinated, but we just don't have all the answers as of yet, and there's no vaccine that is 100% effective.
So even though life will not really return to normal in the short run for those who get vaccinated, how long does this immunity last to at least ease the worry just a little bit?
So there are a number of factors that are going to determine when the pandemic is going to be over. Vaccination rates, number of cases, number of deaths from COVID. After being fully vaccinated, you can be a little bit more relaxed. The chances of you getting COVID-19 infection is going to be lower. Again, remember that this is just one tool to help with the pandemic. But again, it's going to take a lot more than just vaccination for the pandemic to be over. So again, mask wearing, social distancing, avoiding crowds, it's still, again, the way to go so that this is over sooner.
We have more information on the COVID-19 vaccines available and what this means for you on our website, toplinemd.com.